All right, everyone. It seems like we're live and we are joined by Melanie. Hey, Melanie.
Hi.
Hey. You look so good.
Thank you. I'm late because I was like, forgot how long it takes to get ready.
Oh, we're so happy to have joined us. And welcome everyone that is watching to this amazing panel that we're having tonight. Say hi, everyone. Um,
Hi.
so today
Hi.
we are going to be discussing about, post-op experiences. Um, and I am joined by four lovely ladies that are going to be sharing their personal experience with surgical operations. And I do understand that this is sometimes a very sensitive and very personal topic, but nonetheless, I definitely think uh, it's a topic worth discussing. There are many questions about surgery that I think. Need to be answered. Um, I am very candid about the fact that, I am also in the process of getting surgeries, but there are still so many questions that I have. Questions that I relay on my friends, on my colleagues, on my boss. Diana was definitely one of them, and I was so lucky to have met her. Where she just taught me everything that you need to, to know about this. Um, but nonetheless, I want to welcome Breonna McCree, Diana Days, Melanie Ampon, and Diamond Stylz. We all have a little bio that we're going to put on once you each step up to the plate and talk about your personal experience with post-op. But, um, I definitely want this. I also wanted to remind everyone, as I reminded all of you, because um, for trans people, there, we're under this pressure of having to, to pass, and passing it's like it's something that was pushed onto us. I really don't think trans people should abide to. Um, I always like to believe that there is something special in trans people, that we have found a way to really break down the barriers and expectations and pressures from society and be ourselves. And I find it very disconcerting that, we find ourselves also in this place of having to pass, quote unquote, because it's not real. And I just wanted to mention that, surgery is not something that's a universal aspect of transition. Surgery is not needed to be the person that you want to be. Surgery is not needed to feel good about yourself. And surgery is not needed to live the life that you want to live. But I definitely wanted to make sure that we took this opportunity um, to talk about this for those that are interested, like myself, and I'm sure there are some viewers that are also interested themselves. Um, but nonetheless, I want to hear from you because I know that you all have a lot of wisdom, a lot of information that is very valuable that I'm dying to know about, and that I'm dying for those that are watching to also know about. But I definitely want to hear from you all. Whoever wants to go first, no pressure. But just tell us about your experience, what it was like navigating the medical system. I have Kaiser. It was very hard navigating Kaiser. Some girls don't have medical insurance. So, were you one of those people? How did you navigate surgical procedures? So on and so forth. What was recovery like? Did you have a support system while recovering? Which I think is very important to have a healthy recovery. Um, but take us away, sweep us away. Whoever wants to go first. Um, Diana, would you like to go first?
I was gonna hide. I was gonna go like I was just gonna kind of get out of the picture. Sure, why not? Thank you, Jupiter. I think it might be your mic, Jupiter, that is making a little bit of noise. Can you guys hear me well?
Yes.
Okay. All right. So, just first of all, just 2 quick disclosures on my side. Please assume best intention. So what I'm saying is, comes from my heart, and it's my personal experience, and that's the other thing I want to say. This is what happened to me, and I'll give you the best account, and it's not by any means everyone else's story or how it has to be, so but I will share my personal experience. Thank you for writing that. Yeah. So I had surgery at the end of 2018 with Kaiser. I had a couple of other surgeries prior to gender reassignment. I had facial surgery in Spain. I had a couple of body surgeries in Tampa. These were all out of pocket. And then I had voice surgery back with Kaiser when they used to do that, and gender reassignment. In fact, gender reassignment out of all the surgeries is the one that I'm happiest with. I'll give you a little bit about the mental aspect of this. I moved, now I'm in Argentina. So I moved from Argentina to Berkeley, though I'm a US citizen, but I moved there about 4 years ago now to live as myself, to live as Diana. And I almost felt like, in looking back, it almost felt like, okay, let's get everything done and as fast as possible. And so I think that also my peers and everyone was, it was the time that everybody was getting surgeries and stuff. And that is the one thing I'd like to share, is that not that I regret any of these surgeries, but I definitely, despite my age, I'm just turned 56, I would have done things a lot slower. I would have thought about things, listened to the different opinions. Kaiser has been amazing. I have nothing bad to say. I mean, in general, if you look at everything that I get through Kaiser and that a lot of my friends have gotten through Kaiser, I really like, I really enjoy the system. But, it is definitely really nice for someone that perhaps, like, I couldn't, I spent a lot of money in those private surgeries, which I would have done differently. I would have taken some time. And yes, Kaiser would have been a top choice for gender reassignment, regardless of the money. But for example, my face, I went to Spain, and I think I spent a fortune, and maybe I should have waited for some of the doctors in the Bay Area, which are amazing. And if I would have, done my insurance thing and everything, maybe I would have gone with them.
Diana, if I may ask, what led you to Spain? Was there like a doctor specifically that you were looking for in Spain?
I went to facial team, and it was the thing, it was like the thing. And I have a friend who lives in the Bay Area, and she did a lot of research and everything, and she told me, look, don't go to them because they do the coronal approach. And then I had like a second interview with one of the doctors, Dr. Capitan, and he just told me, look, if you were my sister, I would do the coronal approach. And truth is, coronal approach, and then I had the simultaneous hair transplant. That was a fortune that I spent. And truth is, at a certain age, simultaneous transplant, most of the hairs die because they do it at the same time of the surgery. And for the coronal approach, they had to go way back here. So I literally spent a lot of money, I don't want to say how much, that I could have spent differently. And I was also considering Thailand, Dr. Suporn, for the gender reassignment. After meeting a lot of, I had gone to Marcy Bowers also with Marcy Bowers. She was very nice, and she, I sat in her office. Literally, she held my hand, and I started crying because it was meeting Marcy Bowers, and she said, "I'm going to get you on the list, and you're going to be, I'm going to get you because you live in the Bay Area. If I have to perform a surgery on a Saturday, I'll come in. I'll do it on a Saturday." And so she told me it was going to be within a year. I never got the call, and I had the opportunity to do it with Kaiser, and I don't regret it at all. And I left her $1,000 deposit, which I never saw again. So, a lot of these things you just kind of like boom, boom, boom. And to be honest, I would just take my time, do the research, see what's available, and see what suits you. Do you have any other questions you want to ask me?
I know, but I'm very glad that you touched on this topic of Marcy Bowers, and also Kaiser. I do have some friends that are in line for, a Marcy Bowers operation, but there's this misconception that like, oh, if you get an operation with Kaiser, like you don't really get the best, the best vagina. And I definitely think that's definitely a misconception. I consider Kaiser, especially the one that's here in Oakland. They are the only Kaiser, the only like medical facility in the whole country that has a whole department set aside for transition related operations, processes. And I also find myself having a lot of trust in the doctors at Kaiser. But there's other girls that are under the impression that having a Marcy Bowers operation and having Marcy Bowers be your surgeon somehow like elevates like the esteem or the perception of like what you have. And I'm very happy that you touched on this thing that like, I was able to get an operation with Kaiser prior to getting my operation with Marcy Bowers, and I didn't regret one single thing about it, which was great. I am also, I'm currently in the process of, getting that big operation at Kaiser. And something that I really think about, that I'm sure all of you can attest to, or probably contribute to the conversation, is the recovery process. The whole thing about dilation and sort of like the blood involved and the pain involved, it's definitely something that really scares me. So I just wanted to know like what it was, Diana, like if you're willing to share what it was like having to go through that recovery process and through that dilation, having gone through Kaiser. It's definitely something that really picks at my brain.
I was fortunate to have Dr. Salim in Kaiser, and I've always said that if Dr. Salim was out of Kaiser and would have his private practice, he would be among the top surgeons in the Bay Area. I think Marcy is great, but she's more, there's a lot of, Marcy Bowers, same thing that happened to me with facial teen. I think she sees a lot of people. I think that for what I understand, the post-op care is not so good because you get sent home. I think Haiti, I don't know what her name is, from Mosaic Care. She's doing a tremendous job. I'm not sure, I don't remember her name right now, but I have a lot of friends that went to see her. She's the person who's doing the peritoneal pull through. So a lot of things that you guys can look at. I understand, and I talked to Salim. I understand he's doing that as well, because there's a lot of younger folks that don't have enough material. So I think they are starting to play with that, to understand, because it's kind of the new thing. But yeah, Kaiser to me has been very good. In regards to post-op care, I was very consistent with my dilation in the beginning, with the schedule and everything. And I was one of those fortunate people that everything worked. I think that probably had the first big probably about a month or month and a half in which I was totally surprised. And so functionally, everything okay. I was very lucky. I had pretty decent depth when it comes to death. But yeah, it's a chore, mentally demanding. You need to stay on schedule with dilation, and for me, it was a process. It would take me a while. So instead of doing it probably, after a few months, instead of doing 3 times a day or twice a day, I would just probably do every other day a long session, and it worked. But yeah, I can tell you now, being 2 years and something post-op, that you have to keep doing it, or if you're lucky, you can have a partner, and that's another great thing, another great way. But it's something that, at least for now, if I goof off for a while, it closes up, and I need to kind of restart the process, not from scratch, but it hurts. So yeah.
I think it was you that told me, that was just like, when you're in the process of dilating, don't dilate, get a boyfriend.
Oh, did I? I'm sorry I said that. No,
No. I just thought it was funny, but
get a partner. I never said get a partner, because it can be a girlfriend as well.
yeah, I mean, yeah,
So,
I appreciate it. But yes, I thought
just
that was
kidding.
funny. But
Yeah.
also, Diana, where are those $1,000 that you gave to Marcy Bowers?
Now, I can't, she disclosed, her secretary disclosed, but I personally spoke to 3 other people that went through the same thing, just this saga. Because, you're talking about Marcy Bowers, so there's this big hype. I love her. I met her in person a few times, but it's a bit of a hype. And I just, Wittenberg is the person the name I was looking for. Wittenberg. She's doing an amazing job. So you can check her out. I've seen, and I've hosted one person who had Wittenberg, and she turned out amazing. Almost you can't tell. I've seen it firsthand. It's incredible. I have another friend who had her surgery about 3 months ago, and also a very good job with Wittenberg. So
Yeah. Thank you, Diana. I really appreciate that.
right.
Brianna, what do you have to say? Can you tell me a little bit more about you?
Yeah, I definitely can add to the conversation about surgery. I definitely want to start off by saying listening to other people in the community can definitely sway your decision, but your outcome will be your outcome. If somebody had a good experience, you may not have one. If somebody had a bad experience, you may not have that same experience. Your outcome with any surgeries are going to be your outcomes. Going through the process for me at the time, and it's really crazy. For some reason, me and all my girlfriends have stopped talking for some reason. So there went my support system. I think I was really lucky that my parents stepped in to really support me in this process, which was really amazing. I heard that it was happening. I had some reconstruction issues going on. I had a surgery before. I went to Kaiser, and for some reason, in the middle of the night, I woke up and I was just standing in a pool of blood and had to be rushed to the emergency room. So that's when I found Kaiser, and I saw that they were offering the surgery through Meltzer. And I had always heard of Dr. Meltzer through friends of mine. So we started the process going through Kaiser. For me, it was really easy. I'm not sure if it's because I had knew some of the people on the team at Kaiser through meetings with UCSF. So in talking to them and meeting them, it was fairly easy, and it went by really fast. At that time, there really wasn't a waiting list, and it happened within a couple of months, I was going to my pre-op appointment to meet him. And then I would say 4 months after that, I was in Arizona for surgery. Dr. Meltzer at the time was working out of this boutique hotel in Arizona, which you would stay almost 10 days to make sure everything is okay before you went home. While there, it was me and maybe 4 other girls there at the same time. 2 were leaving in about a week, and me and another girl had just got there. We get there, we have our surgeries, we're asleep for about a day after the pain. And then you wake up the next day and you start to meet the other people around you in the surgery center. You meet the nurses, you meet everyone. And the hospital was really nice. The surgery team was really nice. I think the only thing I was afraid of at the time was, will it come out okay? Is it going to be what I wanted it to be? Is it going to be what I needed it to be? And I didn't have those conversations with him. I didn't have those conversations with anyone before doing this. I was just in my mind, this is what I wanted. This is where my journey has led me. And I'm okay with the outcome, whatever it may be. I'm also the type of person that whatever you tell me to do, I'm gonna do it. I'm gonna make it work. If it doesn't work, then we'll come back to the drawing board. I didn't mind. So I had the surgery. Everything went fine. Dilators. Before I left the hospital, he makes sure that you don't have to come home with the catheter. You have to pee before you leave the hospital. And that was a fear because some girls have to go home with the catheter. I didn't want that to happen. So I made sure that I continued to drink a lot of water in the process to fill my bladder, to force my bladder to urinate, because some people don't urinate. It takes them forever. And sometimes they have to go back in and fix that. I didn't want that. I did exactly what they told me to do while I was in the hospital. When it came to dilating, it's really funny because in the hospital, they were saying, watch this video. This girl talks about dilating. I think she was from Canada. And she talks about dilator 1 and number 2 and number 3. And she got to number 4 and she was like, oh, I'm not doing that. So all of the other videos while laying there with the packing still inside me, watching these videos of girls not doing dilator number 4. And I was like, I need number 4. I need to do number 4. So before I left the hospital, you leave the hospital, you're supposed to be on dilator number 1 and 1.5. I was on dilator number 2 and flirting with dilator number 3 before I left the hospital because I knew what I wanted out of this. This had to work for me. I knew what I needed this to do and I needed it to work. So in talking to the staff, I would tell them, this is working out great. I'm having fun with this. It's really no pain. Mind you, I'm still kind of on painkillers. But I was like, I'm really not having a lot of pain with this. I'm going to try dilator number 3. And they were like, you're moving too fast. Slow down. And that's the story of my life. I'm always just moving really fast. So I slowed down. I stuck with number 1. I skipped number 2 because it had this, 1.5 because they had this hook. I didn't like it, didn't feel good. So I went from 1 to 2. Consistently, that was my life. I think I took 6 months off of work to stay home to dilate. When I got home, I made sure I had a month's worth of soup and whatever I need that I could reach for and not really have to move. I had all of my arnica, my creams, my peels, everything I needed because I knew that I was going to be in this position on the couch dilating. I set up a TV in this extra room that I have in my apartment so I could just sit in this place and dilating. And that was the major part of my life for like 6 months. Yeah, for me, everything was fine until I looked down there and I was like, I want it to look a little differently. What's that process? And so we don't really talk about going back for revisions. When you talk about revisions, people are like, oh, something was wrong. No, nothing was wrong. I just wanted it to look a little different. So I didn't mind having a revision. So I went and I had a revision to make it look the way I wanted to look. And so after I had the revision, it was great. But I wanted it to look a little more different. So then it just became this obsession with the way I wanted my vagina to look. This was my vajastical experience, and I wanted it to be my vagina fantasy. And so I wanted what I wanted. Some people get caught up in, well, I want it to look real. I want it to look like hers. I was like, this is fantasy over here. I want to be fantasy cunt, and I need this to look like fantasy puss. So I went back and I had another revision because I just needed it to look like the way I wanted it to look. I needed it to feel the way I wanted it to feel. I didn't want to let anyone else's opinion sway what I wanted my vagina fantasy to be, my experience to be. So when I talk about this, I talk about have your own experience. Your vagina experience is going to be your own. It's not going to be like anybody else's. It's not going to feel like anybody else's. It's not going to taste like anybody else's. It's not going to feel like anybody else's. Make it your own. Don't look for anyone else to make your vagina feel the way you want it to feel. You make your vagina feel the way you want it to feel. And what you do is you get to know her. This is somebody new in your life. This is your new lover, your new best friend. You have to treat her, you have to treat her a certain way. So you have to spend time with her and get to know her and love her, wine and dine her. And I swear, I fell in love with my vagina. I love my vagina, and I make other people love my vagina. So that's just been my experience of me and falling in love with my vagina, and yeah, treating her the way that I want to be treating her, and making everybody else treat her the way I want to be treated, the way she needs to be treated, the way she needs to be worshipped.
I love that. I love that. You really put this into a really beautiful perspective because I can't wait to meet my vagina, and I'm sure she's going to be my best friend. Did you ever get to dilator number 4? Somebody in the comments says the orange dilator is definitely an obstacle most want to conquer. I'm scared.
So I'm gonna, I'm a Black woman that lives in Oakland, that likes to do Black things, that likes to do big things. So I not only conquered dilator number 4, but there is a dilator number 5 that you can buy. They don't give it to you in the kit, but you have to buy it on your own. So I bought dilator number 5. Now, when you try to buy it, Dr. Meltzer's office would try to talk you out of it because he's like, you're not going to use that. Nobody really ever gets to number 5. It'll be a waste of $100. And I was like, run me my number 5. My daughter wants to meet number 5. She's been good with number 4. She wants to meet number 5. I love when Diana said, at times, if you don't use it, she will start to close up. She will. And that's for any woman. If you're not using it, it will be on entry. It will be a little, tighter. But once you open her up and love her and rub her and sweet talk her, she opens up. It's a muscle. You have to work her.
I love that. She opens up. That's a good way to
She
put it.
opens up for you.
She
Yes.
opens up for you. Yeah. I look. Thank you, Brianna. That was such a beautiful sort of like, the way that you painted that picture. You should take the place of that Canadian girl in that video. We're gonna have to make some arrangements for that. But AP Thomas on the comment said to thank you for sharing your story. I'm sure AP also enjoyed it the way that I did as well. But I also wanted to
Yes,
hear,
definitely.
of course, Diamond. I saw you in the back. I want to hear from you too.
Hey, how are you? I love Brianna. She is always going to put it in perspective, and I love how she, she allows you to own your experience and gives you a level of freedom and kind of release the shackles of expectations of being like somebody else or your experience. If it's good or bad or what differences, your experience is yours, and it's your responsibility to really embrace everything about it. That is a certain level of freedom, and I love that. I love that. I appreciate it. So I think that I am the non-op girl on the panel. I think so. Right. So I come from a area in the country where the infrastructure for surgery and medical care is not as progressive as California. I grew up in Indiana, Mississippi. I'm currently in Texas. So we don't have a Kaiser. We don't have those type of things. But for my own personal experience, I opted out of going. My transition was rooted in my main surgery was my FFS. It was to get me to the point where my body to everybody else and to myself was it was a safety thing. I wanted to pass. It was rooted in cis heteronormativity. And while I understand that new age conversation about dismantling the binary and dismantling those things, I am a girl who is okay with where I am in the binary and okay with the binary and okay with you know, navigating the world with a standard of cis heteronormativity. And so for me, that works for me. But I also understand that it doesn't work for everybody and everybody needs to be free. So for me, my surgeries, I come from a different place. My surgery was about, I'm a Black woman. I wanted my body to be a certain way. I wanted to have a certain natural look, a natural swing, a natural sag and jiggle. And, it's just something that I wanted to have because we didn't it's actually when I was growing up, having implants, having things that didn't look natural actually got you clocked where I'm from. So I couldn't the girls who were getting like implants and stuff like that, it was something that was kind of a barrier in that passability because cisgender girls in Indiana didn't have, implants. Not some, but I'm from the hood. The hood girls where I'm from didn't have implants. So it's something that the dudes would be like, So I opted, not that it's not, I wouldn't suggest it now, but at the time, I opted to, for silicone. Um, and it worked for me. I was blessed to be connected with the right people, and it actually worked. And I love my experience with silicone, and I love my experience with my FFS. So I didn't go through a process of any negative experiences, but I saw girls who I have a friend. She had some horrible experiences with silicone, um certain doctors being botched, and it was scary because all we were trying to do was be girls. We just wanted to have the surgeries to, live the life that we always dreamed of. And so seeing those negative experiences was kind of scary, especially for a girl who didn't living in these states that don't have the structure, doesn't have the comfort of these doctors that know what they're talking about. We would go to doctors and they would turn us away. We would go to doctors and they would tell us that they're not willing to do it because it's against their religion. Um, and these were the doctors that everybody was recommending, and all that kind of stuff. So it was so many obstacles. But for me, I had some great experiences under the table. Going to Mexico, I went to Dr. Cardenas. I went to Dr. Molina and in Tijuana, and I loved it. I loved everything I got. I loved what he did to my body. I loved the softness. I loved everything about it. So for me, it was a blessing to get where I was and not and in the status that I was, to get there and not have any issues.
Did Dr. Cardenas do your FFS? And how did you find Dr.
Yes.
Cardenas?
Say that again.
How did you find Dr. Cardenas?
So my best friend at the time had went to him maybe like 2 years before, and I was a girl that I just wanted to get my brow. I had a big ass brow, and I wanted to get my brow gone. And so when I left him, my goal was to have a smooth, cute little brow. I didn't want that cranium, that you know ape cranium. I hated that shit. So I was like, hey, I'm about to go down to him because what he did for her was great for me. And I wasn't a girl who wanted to, like, the dream person, I guess, the way y'all were talking about Dr. Marcy Bowers, the hype person at the time when I was growing up, that was the person that was to go to, was Dr. Asserhoff. He was for FFS, he was the one that was like, oh my God, he's the boom. But he did have a certain elven look. The look of when the girls were done, there was a certain, like an elf. It was, their nose was slim and turned up, and it was just like an elf. Not that that's not beautiful, but I'm a black girl. I want to look like a black girl. When I leave the table, I want to look like the ethnicity that I was born into. That's what I wanted to look like. And so I was like, I don't want to go. Not only was he astronomical, but even when I got to the point where I could afford somebody that could to go to in that regards, I still wanted somebody who I kind of knew that was going to do what I wanted them to do. And so Dr. Cardenas had done well with my homegirl. And so I went down there. He was talking right. I stayed in what do they call it? It just was a house similar to what Breonna described, where we would go down to Guadalajara, and we're in the house with other patients, and there's somebody living in the house with us that is cooking for us and taking care of our bandages and taking care of us. And so it was just an amazing experience. And so I was like, well, I went down. When I talked to him, he was like, I told him exactly what I wanted. I wanted just my brow bone done. I don't want my face to be totally different when I come up. I want it to be my face, because I thought that there were certain things about me that I already liked. So I don't want you to just change totally, but I just really don't want that brow. And I don't got no brow no more. So it was gone. And the recovery process was crazy because I woke up and I looked at like Frankenstein. You got the stitches right here. And then as you can see, even without surgery, I always got tight eyes. So as soon as that stuff started swelling, I was looking Asian, and it was just super, super big. And I still have the pictures, and I love going back and look at them, but it was scary at first. And then you can feel your heart throbbing in your brain, do, 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 all this kind of stuff. And I have friends there to support me, but it was a very, very wild experience. It just was wild. But at the end, it healed nice. They called and took care. I stayed there for maybe like 10 days. They took some stitches out, and they just was really, really nice. And I know Mexico has a like a bad rap because of, you know, other doctors, but him in particularly treated me really, really great, nice. They had like laser stuff shining on my face to help me heal. It was just so amazing. And I have no complaints about Dr. Cardenas. Yeah.
I'm glad to hear. Thank you. You know, to add to what you said about Mexico having a bad rep, I'm Mexican, and I grew up with, I don't know if y'all know who Alejandra Guzman is, but she was this like Spanish singer that she almost died because her surgeon put cement on her ass to make it look bigger, and she
Wow.
fell ill, and she was like in a coma for weeks. That always stuck with me, and you know, it's something about Mexico that I'm very scared about. But I also like what you said, that, you know, you just wanted to change a few things but still be yourself. I feel like many of us girls are under that same impression that, like, oh, you know, if I get FFS, you know, my whole body, you know, my whole face is gonna change, which is definitely you know, something that is scary. I don't have FFS, and you know, I also very much sort of like love my face. Are there things that I would change about it? Absolutely, you know, as everyone would. But it's definitely something that is up to, you know, your need and what you want and what will make you feel beautiful. The doctor at Kaiser was also the one that told me, she was like, this is all for you and all for something that will make you feel better, which I, you know, would really appreciate. And, you know, you also putting that out there for our viewers to know that it very much depends on you and what you want and how you want to feel and how you want to look. It's, you know, the right message.
Yeah.
So thank you, Diamond. I really appreciate that. Melanie, hey girl, you've been too quiet. What's up?
Hey, love. So, I have to agree with Diamond. Like, my most, you know, the surgery that changed my life was my FFS. You know, I mean, I've gotten surgery too. I have silicone in my hips. I got silicone in my cheeks. I got silicone in my jaw. I got silicone in my chin. But honey, it's like back in the day when insurance wasn't even a thing, you know, the girls had to do what they had to do. You know what I mean? And, you know, I love what you said, Jupiter, that you love your face. It's like before my FFS, I loved my face too. I loved who I was. I loved me. But, you know, I was also, and a lot of the girls, you know, can attest to this, you know, we can be masters of illusion, honey. When you don't like something, do something about it, you know, contour the fuck out of your jaw. Or, you know, for me, I had that brow bone too, girls. So I was like, put me some bangs, girl. I had bangs for 10 plus years. You know, I was tired of those fucking bangs. So for me, it's like, yeah, you know, I did love my face, but there was definitely things that I wanted to, you know, that would have made me feel more comfortable in my own skin. You know, I felt like before that I always had to put a mask on. You know, I would never leave the house without makeup. I would never leave the house without, like, you know, my bangs, you know, covering my forehead. Don't get me wrong, there's still things that I'm, you know, insecure about, as everybody is. But you learn to just accept, you know, the flaws and find the beauty in the flaws. My biggest thing, I went to Kaiser, and you know, it reminds me, like when Diana was saying that she wished that she waited longer. I feel like I waited way too long, you know. So, you know, a little backstory. I transitioned when I was 14 years old in high school, back in the 90s. And back then we didn't have the internet. We didn't have Google. We weren't able to, research, what hormones were. So I didn't even start hormones until I was 19. And I didn't even know what the word transgender meant until I was 19. I was living my life this whole time not knowing who I was. So it was kind of just like a roller coaster ride. Then in my early 20s, that's when I started, getting the silicone, because that's all I could afford, really, to be honest. I was, came from a family that was, not rich. We were very not super poor, but we weren't even middle class, I wouldn't say. I didn't have the luxury of, going to college. I didn't have the luxury of being able to have a savings account until I probably was in my 30s. I was living paycheck to paycheck. So, given that I, kind of transitioned when I was 14, I wasn't even able to get my first real surgical procedure until I was 29, and that was, my breast augmentation. And that cost me back in the day, and I was 29, so I'm 37 now. So that was 8 years ago. And she was a cute coin. I paid $8,000 for that. And I know that seems like, not that much to compare to other people's breast augmentations, but that was a lot of money to me. And I never actually thought that FFS would be in my cards. I just never thought that I would be able to afford it. I was just like, okay, I'm just going to live like this forever and kind of just have to hide the things that make me feel, insecure. Until, and thank God, for these leaders that, are trans leaders that fought for us to be able to get our medically transition surgeries, covered, because I would have never thought that this would ever have been possible for me. I was also lucky that I had friends that went through the process. Actually, I had one friend in particular that was going through the process around the same time as me. So she was a little bit ahead of me, but we were doing everything at the same time. So we were able to navigate it together, which was really comforting for me, because we would just talk to each other pretty much weekly to be like, how did you do this? What do we do now? What do we do this? And also there is a Facebook group for Kaiser, transgender Kaiser care. And I joined that, and I was able to get a lot of information there. There's a lot of amazing trans folks on that forum that are just willing to help you and have been through, everything that you can think of. So if you have any questions, you could just make a post in the Facebook group, and there's so many trans folks that are just willing to lend their knowledge and their experience and advice as well. So that was very helpful too.
Melanie, if I may ask, do you know what the name of that group is? So I can just put it down there so people can register if they would like to.
Hold up, honey. Let me go to the Kaiser. Let me go to the Kaiser.
But I wanted to ask, did you find that having a friend along the process with you, did it help you? Sorry, that was me. That was my roommate. He's making pasta for dinner. Thank you.
Oh, definitely.
Okay.
Definitely. I, like you said, before, I think in the beginning of the panel, how, it's hard to navigate.
Yeah.
And I definitely think it would have taken me much longer if I didn't have a friend that actually just went through it 2 weeks before me, because I didn't know the process of it. You have to call the gender health clinic first. Well, obviously you have to have a primary, care doctor. And then after, you have to tell them that you're interested in, transgender surgeries and transitional surgeries, and then they will refer you to the gender health clinic. Then you have to go through a process. You talk to a therapist, and they basically just ask you questions about your life and your transition, and they kind of basically have to like, okay, like, oh yeah, you really do have insecurities about yourself that surgeries can help you with, and then they'll basically say yes or no. And honey, like most of the time they'll say yes. um, and then you have a consultation with your surgeon. For me, it was Dr. She. Hey, Dr. She. And I also did my research with Dr. She too, just because also the Kaiser doctors are just not as exposed as the other doctors, like Dr. Harrison Lee that did like Caitlyn Jenner and Nikita Dragon and a lot of other trans people. You could just look online and they'll have before and afters. With Kaiser doctors, you'll only see them when you go to your consultation if you ask for it. And I actually knew some folks that went to Dr. She beforehand, and I saw the results and I was like, okay, I feel comfortable, and that's the thing. You always have to feel comfortable. You have to try to do your research. I'm sorry, I got sidetracked. I'll get that Kaiser group, but like I would, I went to the Kaiser group. I said, did anybody go to Dr. She? And then it's like, you could see and talk to people that have went through the process and kind of just do your own research. And that's the thing. It's like, you just really have to do your own research, because what's right for somebody else might not be right for you.
Yeah, I agree, and I appreciate you for saying that. One of the reasons why the transgender district, as to why we prioritize having conversations that revolve around trans health and wellness, is because sometimes when we are researching like surgery, sometimes we put ourselves in very dangerous and very uncomfortable situations. Going to doctors that don't necessarily have a good track record with recovery or such, but the need to address our dysphoria is like eating us alive, and we sometimes go under the knife, not really sure 100%, is this the right doctor, is this the right procedure, am I making the right decision? So this is why I think it's super important that we're having this conversation, and how you said, do that research, like really ask. For me, something that has really helped me is having like firsthand chats with like people that I know. And I sometimes you like read online somebody's experience, like you don't know this person, like as to like Breonna said, if someone had a bad experience doesn't mean that you're going to have a bad experience. If someone had a good experience doesn't mean that you're going to have a good experience as well. And I definitely think that like making really going online, now it's easier because the internet exists, and there's also so much visibility with trans people, like you said, Nikita Dragon, Caitlyn Jenner. People are obviously intrigued as to like how do they get their surgical procedures, who was it. So I think that's also very interesting, and I'm very glad that you mentioned. And to those watching, we are now entering like the Q&A portion of this panel. So if you have any questions that you would like any of our panelists to answer, please drop them in the chat, whether you're on YouTube or Facebook. Add your question and we will get to it. But
also, I just wanted to mention that Kaiser group, I emailed it to you, Jupiter. So, because I don't think I could have copied and shared the link or something. So yeah, just to let you know.
Yeah,
Let
thank
me
you.
add this as well.
Yeah.
It kind of piggybacks on what all of us have said so far. We already, as trans women, we already have dysphoria that's pushing us. Do you feel what I'm saying? And different levels of dysphoria, but it already is pushing us towards surgery. Is really imperative that we don't add other things to push us when it comes to like our homegirls, how fast their transition is going or how fast their surgery came. Don't add that pressure of trying to compete with other girls. In y- as as everybody has said, your transition is yours. We already have the pressure of society. We already have the pressure of dysphoria. We don't need any more pressure in pushing us in the direction of surgery. So don't base your experience and don't rush and push your experience just based on what's going on around you. There was a lot of times where there was a lady that was pumping in Ohio and everybody in my city was going to get pumped. And now those same girls got hard rocks of silicone in them because everybody was rushing to have breasts first, to have hips first, to have body first. And for me, I just never had that kind of pressure. So I just want to emphasize just like your transition. If you just because you're going slow, I had to get, like I said, we didn't have Kaiser in where I live. So I had to get 2 jobs. I had to work as a manager at um Ulta and was an associate at Bath and Body Works. And I would come to one job in the morning. It was hard for about 6 months, but I got to the point where I had to pay for everything out of pocket. So I wasn't going as fast as I seen other people going, but what I got at the end of the day was what I wanted. And it was the process, it was my own personal process. So make sure you're not pushing yourself. This is not a rush. I know you already have the feeling of dysphoria that's pushing you, rushing you. You don't need to add extra stuff. Just enjoy the journey and the process of getting there. Enjoy your experience.
Um, yes. Um, yes, 100% agree to that.
I
Something that
wanted to thank you.
Yes, go ahead, Diana. Diana, can
No,
you
I
hear
just
me?
wanted to agree with Diamond and kind of what I wanted to imply when I said that take your time. Uh, can you hear me? Can you hear me?
Yes, we can hear you. Yes, go ahead.
Am I breaking up?
No, you're not breaking up. There's just like a dissonance in the communication, but go ahead.
I was agreeing with Diamond, and I want to. Okay. Thank you, Diamond, for what you said. When I said go slow, it's not necessarily that I meant go slow. If I could have transitioned inside my mom's womb, I would have transitioned there. But I mean, yes, try to differentiate what's social pressure and what's a smart decision, and do your research and don't go by other people's experiences. Just go see, learn, talk to people. I think that's was the best. And I don't know, it's probably me, but don't think anybody is God. God can, you may have a great result with one doctor, the next person may have a bad result with that same doctor. So, make this your own journey, but make sure that don't add any pressure. I totally agree with what Diamond said. We've already got enough ourselves. So, just it's especially gender reassignment and FFS. Those are one-time surgeries. So make sure they work for you. Be careful, and do the right decision. So that's all I wanted to say. Not necessarily slow it down. Like I said, if I could have transitioned at the age of 5, I would have done it. But so anyways, I just wanted to add that.
Yes, and just to piggyback off what Diana said, Each of our experiences are different. There are some girls that transition very early on in their life, and they might look fishier because of that. And this is what this just to add to everyone's experience is different. You might have not realized who you were until later on in your life. That's something that happened to me. I didn't really know what transgender was. I didn't really meet a transgender person until I got to college. um, but I do meet other people that transition in their teens, when they were still in college, when they were still in high school. So, never judge your experience and your journey with another girl. If anything, I think receiving that perspective and that history of how they did it and how you did it, I feel like really informs sort of like those people that are still figuring out who they are. I wanted to answer a question that Debbie Mayfield had. And the question was, in this new era of body positivity, how do you rectify the need for surgery with self-acceptance? Does anyone want to take that? It just goes into what we were saying, how like we loved ourselves, but there were still some things that I would change, but I will still continue to love myself.
For me, it was getting more
I know.
mature. So,
Diamond, do you want to go ahead?
so for me, it was being more mature. In my younger years, everything was rooted in trying to. If I'm going to be honest, it was so amazing to hear this being um vocalized on the new episode of Dysphoria. I mean, not Dysphoria, Euphoria, with Jules. Jules was saying that her whole transition in the beginning was rooted in the desires of men. And so when I was younger, was true. I wanted to be a bombshell. I wanted to be a vixen. I wanted to attract a type of man. It was rooted in my own transition, but the look that I wanted to have was not rooted necessarily in me. I wanted to be fly. I wanted to be like the video girls. And so, once I got mature and once, certain things started to change for me, like hormones and, certain things, I got a little bit more into what I wanted, specifically not about men. When I looked in the mirror, not how I'm engaging with them, but when I looked in the mirror, what did I want to see? What did I want to see for myself? What would make me feel good? What would make me feel beautiful? What would make me feel sexy? Not for them, not sexy for them, but what would make me, if I'm by myself, enjoying putting my lotions on, putting my oils on, what would make me feel like the goddess that I wanted to be? And so for me, that's what rectified it. It was like, once it was rooted in what I wanted to look like, that was the point. That's when the self-acceptance came. It wasn't necessarily it being rooted in somebody else. That's when it starts to get kind of wishy-washy and out of the body positivity thing. But once it was rooted in my own desires and my own needs, that's what rectified it for me and accepted it for myself. And that's when my dysphoria started to be minuscule. I started to not even feel ashamed about what was going on with my body. I started to feel beautiful and I started to accept it. So, yeah.
Yeah, for me, I knew who I was from the age of 5. I knew that I was a woman. So I understand in this age of body positivity, love yourself, love your body parts. That wasn't my experience in my body from a young age. It was to the point where I would hide parts of my body that I didn't like from myself. There was this disconnect that this isn't even there. This isn't a part of my body. This isn't mine. So after having surgery, it was like a light shined on me just a little bit different. It was like my walk, my talk, everything that I experienced in life was a little bit different. There was something inside me that just turned on. And so I remember having this conversation with a girlfriend about having surgery, and it was rooted in, like Diamond was saying, it was rooted in men and sleeping with men and what a man know, kitty tail. And I was like, if I never had sex with a man, I would be okay, because that is not who I did this for. I did this for me. I did this for when I walk out the shower, I can just stand there and let the air dry me off and feel comfortable. I can walk outside with nothing on and feel comfortable. I can lay in the sun on the beach with nothing on and not have a care in the world. If no one else is around, it was all about my comfortability. And so this is the body that I love. This is the body that I know. This is the body that I've always seen come to life. This is my dream come true. And I feel like it's that for a lot of people, but there is this disconnect in the community between the girls that want it and the girls that don't. And I think that we should stop policing ourselves around our body parts and love what you have. I love what I have. I love what you have. We're put on this earth not to wonder and try to understand each other, but to love each other, respect each other, and get along with each other. And I hate the conversation that comes up around, well, a man said if he wanted that, that's what he would have. A man is not the author of my body, of my destination. No one controls this ship over here but me. Never let a man tell you what to do, how to feel with your body. You are the captain of your own ship. This is your vessel. You drive it, you feed it, you fuck it. This is yours. You need to be the author of your ship, the captain of your ship. Never let anybody else have authority of your body, what you do with your body.
That's so beautiful. Very beautiful. To add what Diamond said about the Euphoria episode with Jules, I listened to that podcast episode that you did, Diamond, on that, and I loved it. And just something that I wanted to add to that is like, I feel like we like wrap ourselves into this perception of like what like men especially like see in us. Like this is something that like Jules, the character in Euphoria, said. Like, you know, instead of conquering femininity for myself, femininity conquered me. And I just suddenly became involved. Like, I just suddenly became this like thing that was to be objectified, that was to be sexualized, that was to be desired. And suddenly, like, I lost myself. Like, who was I if not like a sexual object of like men? And I definitely think that is something that drives a lot of girls to like pursue surgery, because it's like, I want to, you know, and it's like, yeah, but at the same time, like, as Breonna was saying, like do it for the body that you want to like be in. Like, you know, strive for the body that it's going to make you feel beautiful and comfortable and be you. I was also going to say.
And don't feel guilty about when you're young. Don't feel guilty about that feeling either, because how society is set up when it comes to patriarchy, there is social capital and social gains that you can get from fitting that sexual objectification narrative. There is actual gains. We, especially as an ex-sex worker, there's actual gains that you can get by fitting that narrative. So don't feel guilty when trying to do that, but just understand, as an older girl, and what we're explaining to you is that it's a certain level of freedom. It's a certain level of agency. It's a certain level of actuality. When you actually come into your own and be the captain of your own ship, it's a certain level of freedom that you have, and it's a whole new plateau of self-love when it is not rooted in that. And so, and everybody doesn't get to that level of understanding of themselves fast. Everybody doesn't get to that level without going through trauma not necessarily trauma, but without going through the process of learning how to be that for yourself. There is a process in doing that. And it comes with love experience. It comes with romantic experience. It comes with social experience. It comes with community building and your homegirls loving on you and telling you you're beautiful when you're feeling not so beautiful. It comes from a amalgamation of so many things. So right now, if you are young and you haven't got there to that point, don't feel guilty, but just know this is what you're striving for, to be the captain of your own ship.
To answer Regina's question in the chat, she asked if there's a way to play this back to show to their daughter. And yes, Regina, you can find this video on our YouTube. And once it is done, you can go back and replay it from the very beginning so you can show your daughter. And I also want to ask another question also asked by Debbie, which I think it's, something that it's on my mind and I'm pretty sure on the mind of others. Did any of you deal with post-op depression? And if so, how did you overcome it? Diana?
It's funny, I had surgeries abroad and I had surgeries in the US. And it was pretty bad. It took me about a month, but after a month, I was in a very bad place for some reason. I don't understand. I'm not sure. The reason I said I had other surgeries is because my longest surgery by far was my FFS. I think I was, I don't know, like 10 or 11 hours under, but I didn't have any issue with post-op depression. However, I did with, in particular, with bottom surgery and with breast augmentation. So I'm not sure. I don't know, but I'm not sure if it's the U.S. anesthesia or what it is. But yeah, it was pretty bad for me. So I had a psychiatrist who prescribed some medication for a while that I took. I think it was 6 months post surgery. But again, I'm not sure if it's physical, if it's mental, or if it is related to the anesthesia. But it hit me pretty hard. I want to say maybe 3 or 4 weeks after the surgery. That was my experience.
I can add to that a little. I wouldn't say that I had depression, but I had anxiety. Especially after FFS, it's like you look like you've been hit by a bus or like a baseball bat in your face. Your eyes are swollen. You get a black eye. You can hardly eat. I think I could only like open my mouth maybe like a half an inch or to an inch like the first day. Laughing, talking hurts. And then not recognizing yourself in the mirror is a really big mind fuck. And then you kind of go back and you're just like, oh my God, what did I do? Like, oh my God, am I going to look like this forever? And it's like, you just have to realize, sweetie, just take a breath, calm down. It's just swollen. It'll go down. But yeah, definitely those thoughts go through your head. You just question everything that you did. But I think that it's like how I said, I was very fortunate to have, a friend and friends that have gone through this, because they told me that's going to happen. It is going to happen. You're going to look at yourself and you're going to see somebody else in the mirror and you're not going to recognize yourself and you're going to ask why you even went through this shit. So fortunately, I was mentally prepared for it. So I didn't go down like, a rabbit hole of depression, thankfully. But I think also having that support system really can help with the anxiety and depression if it happens.
Did anyone else go through like feelings of, you know, just like feeling anxiety or feeling low.
Yeah, she said exactly what I experienced. Exactly. I was like, what did I do? Looking like, oh, did I fucking ruin my face? Did I do just the whole, even though the doctors, they warn you, they say it's gonna take this amount of time to heal, girl. I'm 2 weeks out. Like, oh my God, what did I do? So yes, the everything she just said, the walking past the mirror, even learning how to paint your face, because we're the masters of illusions. Now you got this new face, you ain't got to put that much highlighter on, you ain't got to do that much contouring. Totally learning how to redo. I ain't even like she said earlier, I ain't even got to put a bang, I can do a bust down now. And all of that, those different adjustments, and getting comfortable with that, and just how it gets better and better over time, because your healing process is getting better and better over time. And so yeah, everything she just said, I'm just parroting because that's exactly what you thought. You like, oh my God, was this a mistake? But over time it gets better and better.
I want to answer another question that was in the chat, which was during a transition, during a transition, did you have micro moments you celebrate? For example, a man holds the door for you, changing your name, etc. But when you get bottom surgery, do you still have micro moments to celebrate? And it can't just be bottom surgery. It could also be FFS. It could be breast augmentation. Did you find yourself that your lifestyle or the way that you navigate the world change after undergoing a specific type of surgery?
I think for me,
Go ahead, Breonna.
You're on mute, sweetie.
I swear this platform. I feel like for me, it was a different way. It wasn't other people. It was a different way that I celebrated myself. It was a different way that I felt when I walked into the room. I was a different feeling when I stepped outside. When I went into places, it was a different way that I celebrated myself. For me, it wasn't about anyone. I'm almost 50. So I have been this woman for a very long time. So I have always gotten through, as we say, with a certain aesthetic. So men would that's been my life. But it wasn't till I did it for myself that really resonated in my spirit. It really stamped some type of golden light within my soul, because it wasn't about anyone else. And I know that we love to think about an outward experience. But for me, having the surgery was such an amazing inward experience that it really changed the way I celebrate myself. And now it changes the way that I celebrate others.
I love that, Breonna. Mine is kind of the same. It's like I feel good about myself, like how I said before, like pre-FFS, like I would always have to have makeup on, my bangs done, everything done, just to feel like myself. But now I see myself in a different kind of beauty. I see myself and I accept my flaws and I love my flaws now. Like, my thing is like I feel so comfortable. Just I can go out in the world, wear some sweatpants, and put my hair in a messy bun. Mind you, I still wear a scarf because of the FFS scar on my forehead and hairline, but I feel comfortable just leaving the house without having to put a mask of, a mask on, or having to put hair on and clip in extensions, or put a push-up bra on. Like, I feel comfortable just being myself with just stripped down. And I think that's something that I've had to, come into with maturity. It's like I don't have to be, dressed to the nines all the time with stiletto heels, lashes up to here. I think that is one of the things that I am really grateful for, is just being comfortable in my own skin now.
I wanted to ask one final question because I think it would be a really beautiful question to close the panel with. And the question is, what is one piece of advice that you would tell your younger self in regards to navigating gender affirmation surgeries? And just to further elaborate on that, like, would you sort of like change the doctor that you went to? Would you sort of, change the timeline of like how you pursued some surgeries, or, any preparation or any stuff like that?
I guess I can start. I mean, what I would tell my younger self. Well, the thing is, first of all, I don't even think I'm done doing surgeries just yet. So, and kind of like going back to my story before, I waited a while to do them. So, just take your time. Things are meant to happen when they're supposed to happen, and just trust the process, and you'll get there. Don't worry.
Also, there's also another question that you can also add to this final question, or your final answer that Debbie also asked. Come on, Debbie, you asked all the good questions tonight. Thank you. Which was, did your dysphoria disappear once you completed all of your affirming surgeries? And feel free to answer either or, a combination of both, or whatever you would like to close the night with.
So for me, no, it didn't disappear, but in the context of Brianna's metaphor of like that golden light, that light was just brighter. Like it just gave me a little bit more freedom, a little bit more confidence. I was in the light. I don't want to say it totally goes away. Um, I haven't really had any self-esteem issues as I had growing up. I felt beautiful, but this just when I had those bouts of depression, when I was younger, before like laser or something, how you wake up and you got a little stubborn, you like, oh shit, that moment where it's like cringy, like, God damn, I wish I could get this hair off my face. But then once you get laser, and it's all gone, and you're good, it gives you a level of freedom. I ain't got to wear as much makeup. I don't have to, when I'm going to the grocery store, I don't have to be plastered and honey for the back room, painted for the back room. It just gives you a level of freedom and comfortability. I don't want to say I don't have moments where I'm kind of, critiquing myself and feeling not as beautiful sometimes, but it's not always rooted in how passable I am. It's almost like that, whatever that light Brianna is talking about, it just shine brighter on a consistent basis. I don't want to say it disappeared for me, but it definitely does not come, it don't come knocking. You know how I don't know if y'all watch Big Mouth, but you know how the hormone doctor come, the hormone monster come whenever. That dysphoria monster don't just pop up as often. It just comes every blue moon now. So but if I was looking back at my younger self, uh, I can't say I can't say I would. Yes, of course, idealistically, I would start early and da 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 da. Da, but I don't know. I feel like me waiting also gave me a tougher skin to deal with stuff that I needed to do later on in my life. So there's some positive that happened with me having the trials and tribulations and having to be steadfast in my journey with surgeries. There's something that I earned from that that I might not have earned if I had this rich parent that could just pay for everything, da 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 da. So I can't really say that I would totally change everything, but I definitely would reinforce to my younger self to enjoy the process. This is about you. This is not about anybody else. This is not about being passable to your mama because she's judging you every time she see you. It's not about being getting the boy. It's not about, because it was a combination of a bunch of stuff. I wanted to be, passable for my family. I wanted to be passable for safety. I wanted to be passable to attract the man, all that kind of stuff. Really reinforced to myself that this is about you. This is about making yourself happy. And I'll just reinforce it. Yeah.
For me, I would definitely tell my younger self that it gets greater later. It all falls into place, everything smooths out, and you become more of who you want to be as life goes on. And as far as dysphoria goes, I feel like, yeah, it's still there, but it's not as dark anymore. There's a light that shines through it to where it's there, but it doesn't damper my day. It doesn't hover over me in the way that it used to.
I guess I'll add a little bit to that. Definitely the surgeries, I don't know exactly what percentage, but they helped. But I think that when I stopped worrying and I started being Diana, it all just came together. As Breonna was saying, at some point it just happens, and stop getting misgendered. Although I don't think I look, I don't consider myself a very passable, beautiful trans woman, but get gendered properly most of the time, especially by children. I have a small restaurant in Berkeley, and I've had it for almost 3 years. Not one single person under the age of, I don't know, 5 or 6 has ever misgendered me. So it's pretty cool because, I think children, they just look straight into your heart. So anyways, yeah, I just don't, at this point in my life, it's not that I care about, I think that by caring for myself, I can actually care more for others. I have a lot more to give. So yeah, just you'll be okay. Everybody will be okay. Thank you for putting this together. Thank you so much.
Yeah, and that's the test. They say if kids don't say anything to you and kids don't look at you a certain way, they treat you with love, they treat you with respect, then you pass some type of purity trans test in the community. They always say, I've had girls that say, I stay away from kids because kids always get it. And I was like, oh, I love kids. I love the babies. So if you can pass the kid test, you're okay. If you are, falling in line with that passability politics, then yes, that is the test to pass.
They sure will get you together. Why you look like a girl, but you sound like a boy. They will get you right together, baby. Little brats.
I just want to close the night with just sort of like sharing what I'm feeling, which I'm sure people that are watching can also attest to that same feeling. And it is, this feeling of feeling surrounded by love and by support from a community of people that understand and that know your journey and have already, gone through that path. And, I know that this conversation that we just had is going to help someone. And that is something that is very important to me. And it's something that's also very important to the Transgender District, making sure that we, emphasize the voices of people that I think would really guide and would really inform the lived experiences of others. So I just want to thank you all for coming onto this panel and for being vulnerable and for sharing your experiences and for being candid and not holding anything back. I appreciate each and every one of you, and I loved your insight and what you have to say. So I just want to say thank you on behalf of everyone watching, on behalf of the Transgender District, and on behalf of myself as well. So thank you, everyone. I hope you all have a good night. And also to say, this is the first installment of 2. There's another post-op panel with trans-masculine individuals coming in 2 weeks on March 17th, because we want to make sure that we provide an opportunity and a platform for individuals that identify as trans-masculine and what they have to say and what their experiences are. So for anyone that's watching, tune in then and tell your friends. And thank you, everyone. I'm going to unmute everyone so you can all say goodbye. Wait, unmute yourself, but yeah.
Good night. Thank you so much.
Thank you, ladies. Thank you, everyone.
Stay safe.
Honored to share space with all of you.
Thank you, everybody.
Thank you.
Great to see you.
You're all